Avocados have long been celebrated for their creamy texture and rich flavor, but their benefits extend far beyond taste. They may offer superior support for heart health compared with traditional low-fat spreads, such as margarine or other processed alternatives. While low-fat spreads are often marketed as heart-healthy because they reduce saturated fat intake, they typically rely on industrial oils, emulsifiers, and refined ingredients that do not provide the same metabolic or vascular benefits as a whole food source of fat. Avocados, in contrast, are naturally rich in monounsaturated fatty acids, MUFAs, fiber, and an array of bioactive compounds that work synergistically to improve lipid profiles, reduce inflammation, and enhance overall cardiovascular resilience. Monounsaturated fats are the cornerstone of avocados' heart protective properties. MUFAs, particularly oleic acid, have been shown to lower LDL cholesterol, the type most closely associated with atherosclerosis, while maintaining or even raising HDL cholesterol, which helps remove excess cholesterol from the bloodstream. Clinical studies demonstrate that diets incorporating MUFA-rich foods like avocados improve the LDL to HDL ratio more effectively than simply replacing butter with low-fat spreads. Unlike margarine or other processed low-fat options, which often substitute saturated fats with industrial oils such as soybean, sunflower, or palm oil, avocados provide these heart-healthy fats in their natural, minimally processed state, reducing oxidative stress and supporting more stable lipid metabolism. Fiber in avocados adds another layer of cardiovascular benefit. A single avocado contains approximately 10 grams of dietary fiber, much of which is soluble fiber capable of binding cholesterol in the digestive tract and facilitating its excretion. This mechanism helps lower circulating LDL levels naturally, complementing the effects of MUFAs. Low-fat spreads, even those fortified with fiber, rarely provide this combination of healthy fats and naturally occurring soluble fiber. Additionally, the fiber in avocados contributes to satiety, helping regulate appetite and reduce the likelihood of overconsumption of other foods that might be high in refined carbohydrates or unhealthy fats. Beyond lipids, avocados contain an array of micronutrients and bioactive compounds that support vascular health. Potassium, magnesium, vitamin E, and carotenoids are all present in significant quantities. Potassium helps regulate blood pressure, magnesium supports endothelial function, vitamin E acts as an antioxidant to prevent lipid oxidation, and carotenoids contribute to overall anti-inflammatory activity. Low-fat spreads, by contrast, often lack these micronutrients and may include preservatives or partially hydrogenated oils, which can counteract cardiovascular benefits. Avocados deliver a nutrient-rich, minimally processed package that simultaneously addresses multiple pathways of heart protection. A direct clinical comparison illustrates these advantages clearly. In a randomized controlled trial, participants who replaced a portion of their daily diet with avocado showed significantly improved lipid profiles and postprandial metabolic markers compared with those consuming a low-fat, margarine-style spread. Specifically, the avocado group exhibited lower LDL cholesterol, reduced small dense LDL particles, which are particularly atherogenic, and improved endothelial function. Participants also experienced more favorable post-meal triglyceride responses, suggesting that avocados help the body manage dietary fats more efficiently and with less oxidative stress than processed low-fat alternatives. The low-fat spread group, while consuming less saturated fat overall, did not achieve the same improvements, highlighting the importance of fat quality rather than simply fat reduction. Avocados also support heart health through anti-inflammatory mechanisms. Chronic low-grade inflammation contributes to atherosclerosis and cardiovascular disease progression. Polyphenol, phytosterols, and carotenoids in avocados help modulate inflammatory pathways, reducing C-reactive protein levels and other markers of systemic inflammation. Low-fat spreads rarely provide bioactive compounds with similar efficacy, and some may even include pro-inflammatory trans fats if partially hydrogenated oils are present. From a practical standpoint, avocados are versatile, satisfying, and easy to integrate into daily eating patterns. They can be used as a spread on whole grain bread, incorporated into salads, blended into smoothies, or served alongside proteins and vegetables. This ease of use, combined with their nutrient density, encourages consistent consumption, which is essential for sustained cardiovascular benefit. In contrast, reliance on low-fat spreads often limits nutrient intake to a single macronutrient substitution, providing little additional benefit beyond the reduction of saturated fat. In sum, avocados offer a multifaceted approach to heart health that goes far beyond the simplistic low-fat paradigm. By combining monounsaturated fats, soluble fiber, potassium, magnesium, vitamin E, carotenoids, and other bioactive compounds, avocados help lower LDL cholesterol, improve endothelial function, reduce inflammation, and promote better postprandial metabolic responses. Clinical evidence demonstrates that these effects are superior to those achieved by consuming low-fat margarine-style spreads, underscoring the importance of nutrient quality, bioactive synergy, and whole food composition. Avocados exemplify the principle that heart-healthy fats, when delivered in their natural form alongside complementary nutrients, can provide more effective and sustainable cardiovascular protection than processed substitutes designed solely to reduce fat content.